This is the anatomy video for the thoracic spine and the cervical spine. We're going to start with the thoracic spine and the rib cage. So again, this is the same picture we saw in the lumbar spine, but now we're concentrating on the thoracic and cervical spine. The thoracic spine has 12 vertebrae, T1 through T12, and it has a kyphotic curve, so the curve runs back towards the back of the body. The cervical vertebrae has 7 bones, and it has a lordotic curve. So while this looks rather straight, it generally has a curve that runs more like that we see in the lumbar. These are the thoracic vertebrae individual. So again, from the top, okay, the difference here is that the superior articular facets in the thoracic point posterior and slightly laterally. Okay, so again, we'll see the difference in the movements that are allowed in the thoracic spine. The other difference when you look at the side view is that you have these 2 extra facets. These are for the ribs. Okay? So when we move into the thoracic cage, we have 1 through 7 true ribs. 8 through 12 are false ribs, with 11 and 12 being floating, meaning they don't actually attach through costal cartilage to the anterior part of the body at all. Okay? And when we move into the articulation, we have the facet joints right in here. Okay? But then you're going to have these facets here, and those are for the attachment of the rib. Okay? So you can see that you will have a rib attached here, another one attached here. Okay? So these are the costal joints. Okay? The costocartilage joints are the joints where the costal, or the rib here, attaches to the cartilage here. So this is a costocartilage joint. If we go back to the other picture, this is a costal joint. Okay, so costal means rib. Okay. We have the same ligaments we had in the lumbar spine, but we add ligaments that run between the ribs and ligaments that hold the rib heads onto the bodies of the vertebrae. Okay. And obviously we have the circulatory system that runs through the interior of the body that is going to supply the thoracic cavity quite heavily. We're going to move into thoracic nerves now. Again, I'm not going to test you on the individual nerves. We're more concerned about the nerves that run into the arms and the legs. Okay? But the nerves that exit through the thoracic spine generally serve the internal organs, and then they serve the muscles and skin associated with the thorax. So you're going to see nerves associated with breathing, with rib muscles, and then they also serve the autonomic nervous system. So I'm not going to test you on this. This is for your own general knowledge, other than to tell you that the sympathetic division, so the fight or flight part of the autonomic nervous system, that exits the spine through the T-spine and the L-spine. Okay, so all of those functions are here. The parasympathetic, or the relaxation part of the autonomic nervous system, exits through the brainstem and the sacral spinal areas. Okay, so those things that get us ramped up are through the mid areas of the spine, and the things that calm us down are through the brainstem and the sacrum. Now, as we get into muscles, we have the same picture we saw in the lumbar spine. Okay, when we get into the thoracic, we add serratus posterior, we add our superior, we add serratus posterior inferior, okay, and then the muscles that most people know in this area. So on the anterior side, we have the pecs, the deltoid and the arm muscles we'll get into more with the shoulder and the arm. Okay, but we also have the scalene muscles up here. And then on the back side, we have the lats, as well as the rotator cuff muscles. Okay. And then we have serratus anterior, which we will get into in lab so that everybody knows exactly where it is. And it runs right on the side of the muscles, often called the boxer's muscle. The other muscles we have are the rhomboids, and of course over top of this is the traps. All of the muscles that you are required to know, we will cover in lab. So in the palpation section of the lab, you will learn where all the structures you have to know are. So movements of the thoracic cage, we have flexion. And in the thoracic area, flexion is limited to 20 to 45 degrees. Extension is limited to 25 to 45 degrees. Okay, so remember, the facets in this area point posteriorly and slightly laterally. So this is going to limit your flexion extension movements. Okay? Lateral flexion or side bending in the thoracic is 20 to 40 degrees. And rotation is 35 to 50 degrees. So we see far more of our rotation in the thoracic spine than we saw in the lumbar spine. Okay? Then we also have breathing movement. So we have inspiration, which is breathing in, and expiration, which is breathing out. Now we're going to shift gears and cover the cervical spine. So remember, we have 7 cervical vertebrae. In this picture, the bone that's sticking out here, this is your hyoid bone. So this is the bone that the muscles of the tongue attach to. So this is the cervical vertebrae. The pictures at the bottom are cervical vertebrae 3 through 7. Okay. The top 2, most people are familiar with the atlas, which is C1, and the axis, which is C2. So these are the vertebrae, C1 and C2, that allow you the greatest amount of rotation. This is also where nodding, little bits of nodding, and shaking your head occur. So answering yes and no occur in these areas. Okay. The other 5 vertebrae, the facets, so these are the facet joints for the cervical vertebrae, they face superior, slightly laterally, and slightly posterior. Okay, so again, they're in a little bit different placement. And then the other thing to remember is C3 through 5 keep you alive. Okay, this means that if you have damage in the C3, C4, or C5 area, you're at greater risk of death because of the other structures, predominantly breathing structures, that occur in those areas. Okay, so damage to C3, C4, or C5 is more detrimental to the body. So again, we have the same ligament support that we saw in the thoracic and lumbar vertebrae. We have our facet joints, and we've looked at the difference in the atlas and the axis. In this picture here, you can see how they all line up, okay, how they all sit together. And this is our blood and nerve supply. So we obviously have the vertebral column running through the middle, with the spinal nerves coming out through the sides and the discs. The one thing that's really important, people will recognize from this picture the carotid artery that runs down the front of the neck. Okay? But the other thing I want you to be aware of is this vertebrae that's snaking through the side of the vertebral bodies. This is the vertebral artery. It runs through the anterolateral side of each side of the neck. You can rupture or cut this with violent neck motions, and death results from that. Okay, so this is a very, very important artery. There are tests to check if people have weak vertebral arteries, but anybody can have damage to those arteries from severe twisting movements or violent neck movements. Okay. We get into nerves. In the cervical spine, what we're going to be concerned about is the brachial plexus. So it occurs right here. The brachial plexus comes off the side of the neck. You have one going each way. And these supply the nerves to the arm. So there's a list here of each one. I'm not going to test you on that. It's more that you know this area is going to serve the brachial plexus. And the brachial plexus is going to come out the side of the neck, under the clavicle, and then down the medial anterior arm. Okay. Cervical musculature. We've seen most of this before. We have the trapezius muscle, which is the big muscle covering the back. Levator scapulae, which is going to come up the side. Okay. Our deep muscles are of the back of the neck are in the middle picture here. And then we have the front of the neck here. So the bottom picture of the muscle most people are familiar with is sternocleidomastoid, runs down the front. We have the scalene muscles, which hide underneath it. And then this is that bone we saw in the first picture of the cervical spine, the hyoid bone. So we have the muscles from the tongue that come from the tongue down to the hyoid bone here, and the muscles in the front of the neck that run down through here. You can see a better picture of them here. Movements of the cervical spine, we have flexion, so we have 80 to 90 degrees of flexion, which is forward bending. Extension, or looking up towards the ceiling, we have 70 degrees. Lateral flexion, or side bending, 20 to 45 degrees. And rotation, 70 to 90 degrees.